How are you? I hope you are doing fine. This is Dr. Mo here, one of the co-trainee orthopedic surgeon in Liverpool University Hospital. Also, I'm an OSCE examiner in Liverpool University Hospital for final year medical school. So everything will be discussed in our course. Number one, it will be according to the NHS guidelines. Number two, according to what we do in the NHS. Number three, it's basically what we do in our daily NHS life. Okay, so today is the first lecture in our Plab 2 course, and I will be discussing history taking, or I will be discussing basic structures. Okay, I have today three structures. I will discuss number one, history taking in medicine cases. So number one is medicine cases. What is the meaning of medicine cases? I will be discussing how to take history in a case which is medicine. A patient is coming with chest pain, a patient is coming with headache, a patient is coming with tummy pain. Medicine cases. Number two, I will be discussing history taking in counseling stations. Counseling stations. Dr. Mo, what is the difference? Counseling stations are stations that already diagnosed. A case that is already diagnosed. For example, a patient has been diagnosed with epilepsy, or a patient has been diagnosed with diabetes and is coming to you in the clinic for follow-up. So basically the case is diagnosed, but the patient has a concern about something to do with his condition. So this is counseling stations. The third type of stations I will be discussing the structure is blood results or test result stations. Test result station. What is the meaning of test result stations? Test result stations are these kind of stations where you will have in the question in the STEM a patient who presented a week ago, 4 days ago, 3 days ago with a condition, with some symptoms. Then results were done, and then in the cubicle you will have the results there that showed, for example, anemia. So basically it is a test result station where a patient is coming today to discuss his test results. So he came previously, results were investigations were done, and is coming before test result. He's coming to know about the result and what will he do further. Okay, so these are the three kind of stations. So let's start first with medicine cases. All right, so I will start now with discussing medicine structure, the first topic, which is how to take history, okay, in a case that is medicine case. All right, so history taking in medicine cases. This is the first part of the lecture, how to take history in a medicine case. So you need to focus on the structure because that will be the core of Plab 2. Okay, so a patient is coming to you and the question said, for example, 60 years old Andrew Thompson presented to the clinic, presented to the A&E with chest pain. How to take history? So number one, my structure will be P1, P2, P3, Maftosa. P1, P2, P3, Maftosa. This is the structure. P1, P2, P3, Maftosa. Okay, what is P1? P1 is the presenting complaint for which the patient came. So basically that will be my structure. So the patient presented with chest pain or tummy pain or headache or, for example, joint pain, whatever presenting complaint, this is the presenting complaint. So before you start any station, you will start by, when you open the cubicle, when you open the door and you come to the patient, please guys make sure you introduce yourself as well as confirming the identity of the patient. Which one should come first? Introducing myself first or confirming patient identity? introducing yourself first, because in real life situation, if anybody comes to you and said, can you please confirm your full name and date of birth, I wouldn't. Why? Who are you to ask me about my name and date of birth? So confirm your identity first. So, hi, good afternoon, good morning. I'm Dr. Fatih Plab, one of the general doctors here in the hospital. Can you please confirm your full name and date of birth, not name and age? Then the patient will confirm his full name and date of birth. Please, if the station is not something bad, if the station is not pain, if the station is not something that really needs you to be upset, please smile. Please smile. Okay? How can I help you today? Then the patient will say, well, doctor, I have chest pain, presenting complaint. Or, well, doctor, I'm having cough, presenting complaint. So, what to do first? Open question. But before you ask him the open question, please make sure you reflect the patient is in pain. So, I'm really sorry about that. Are you comfortable talking to me? Or should I give you some painkiller? Doctor, I'm comfortable. Then start exploring the presenting complaint. So before you explore P1, make sure you reflect. He's coming with pain. Well, I'm sorry about that. Are you comfortable talking to me? Okay, that's a part of the communication skills. All right. So basically, presenting complaint, explore. How do you explore the presenting complaint? If he's coming with chest pain, the best way is, can you please tell me more about it? Can you please tell me more about your chest pain? Can you please tell me more about your cough? So, can you tell me more about it? Can you tell me more about it? Then by asking the patient open question, it will give you the chance for the patient to tell you everything about the pain or everything about the cough. So can you please tell me more about it? Then the patient will tell you whichever. Doctor, the pain is here, the pain is there, started here, started there. Then you need to ask the rest of the questions. What are the questions that we ask when you have a presenting complaint? Either I will use either or. Either I will use Socrates or I will use Odipara. So either Socrates or Odipara. Socrates only for pain. Odipara for anything else. So if the patient is coming with pain, I will use Socrates to explore the presenting complaint. So can you please tell me more about it? The patient will tell you. Then you see what is left and ask, what do you mean? Socrates. S for sight. Can you please tell me exactly? Can you point to one finger about where the pain is? Can you tell me exactly where the pain is? Onset. How did the pain start, if you don't mind me asking? Is it all of a sudden? Or has the pain started before that and it's increasing? For example, C, character. Can you please tell me what type of pain is it? R, radiation. Can you please tell me, by any chance does this pain refer anywhere else to your body? A and T. A, aggravating or alleviating, can go either way. Anything that makes the pain better by any chance. T, timing. When did the pain start? E, exacerbating. Okay. Do you think that anything that makes the pain worse? S, severity. On a scale from 1 to 10, 1 is being the less severity, 10 is being the most severe pain. Can you please grade your pain for me? That's only for pain. But if the case is anything else, like presenting complaint, cough, anything else but not pain, I will use Odipara. Odipara, again, is the same, similar to the pain. Onset, how did the pain start? Duration, okay? And I for intensity. P, progression. A, alleviating or aggravating factor, anything that makes this cough worse. R, relieving factor, anything that makes the cough relieved or decreased. A, anything else you'd like me to know about your cough? So Socrates or Odipara. Okay, Dr. Mo, what if I open the cubicle and when I ask the patient, can you please, how can I help you? And the patient said pain, and then I said to him, tell me more about it. What if the patient told me everything? What if the patient said to me, doctor, I have chest pain that it started all of a sudden and it's going to my left shoulder, nothing that makes it worse, nothing that makes it better, and it started about an hour ago, and then he stopped. Dr. Mo, I'll be confused. Why would you be confused? Because he told me mostly everything. But how do I know what is missing from Socrates? Can I ask him the questions again? Can I say to him, since when? That will be not good, because that means that you didn't listen to me. I told you since when, doctor. The best way is to recap. Mr. Alex, I'm sorry, in order not to miss anything, I'd like to recap what you've just said to me. You've mentioned to me that you have pain in the chest, central crushing, going to the left shoulder. You've mentioned that it doesn't, nothing that makes it worse, nothing that makes it better. Am I right? Yes, doctor. Then, by recapping, you remember what he said, and you remember. Can you please tell me, on a scale from 1 to 10, how would you grade your pain? 1 is being the less severe pain, and 10 is being the most severe pain. Then you remember. So, if the patient said everything, and you are confused, recap. Then when you recap, you remember what needs to be asked. If the patient didn't say anything, and when you say to him, tell me more, and there is nothing for him to say, then start using the full Socrates or Odipara, and I will put this in brackets, and I will say this is the most important part in your history taking, is exploring the presenting complaint is the most important part. I explored the presenting complaint. I've asked about the presenting complaint. What should I do? The next question will be, apart from your pain, apart from your cough, anything else? So now I will be asking about anything else, and by that I mean, by anything else I mean, apart from the cough, apart from the chest pain, anything else, the patient will give me another symptom. For example, fever. Yes, doctor, fever. What to do? Fever became a presenting complaint. Fever became like P1. Fever became like the chest pain. Can you please tell me more about it? Can you please tell me more about it? Can you please tell me more about it? And again, it became like presenting complaint. Then you explore the fever. Apart from the pain and fever, anything else? So keep asking anything else until you reach the last presenting complaint or the last symptom the patient has. All right, Dr. Mo, fair enough. After that, anything else? The patient said, no, doctor. Then it's your time to ask questions, which we call it differentials. Then it's your time to ask questions, which we call it differentials. But before you ask differentials, which means questions for you to exclude anything else, questions for you to reach your diagnosis, don't forget to ask the main concern. This is the most important word in your history. Concern. This is the most important word. What do you mean, Dr. Mo, about concern? Now I've asked my patient about the presenting complaint. It was pain, chest pain, for example, fever. Anything else? He said no. Before I start my differential, asking him questions, don't forget to ask about the main concern. Apart from the pain and the fever, what's your main worry? What's your main concern? What are you most concerned about? Dr. Mo, are you crazy? Why do you need to ask the patient about his main concern? Imagine if I'm coming with a chest pain and fever. When I'm coming on the way, I was really worried about having a heart attack before I reached my doctor. Why? Because my dad passed away of heart attack. So I was worried about having heart attack. So when I go to the doctor started taking history. And when he took history, he gave me the diagnosis and he managed me well. However, because he didn't ask me about my main concern, which was heart attack, even though I went to the doctor of pericarditis and I was managed, but he did not ask me about what's your main worry, what's your main concern, which was heart attack. I went home to my wife, and then when I reached home, she said to me, what happened? I said to her, well, I had something called pericarditis and this and that. So it was a heart attack? Well, I don't really know. Why? Because I did not ask the doctor the question, and the doctor didn't ask about my main concern. So even though he treated me medically, but he did not treat me psychologically. What do you mean by psychologically? In my mind, I was worried. I was thinking about heart attack. So when you ask the patient, what's your main worry? What's your main concern? He will say to you, well, I was really worried about having a heart attack. Always ask, why are you worried about heart attack? He will tell you, because my dad passed of heart attack. Then you know that in this mind, In his mind, he's worried about heart attack. Then you can have heart attack as a differential. Then in management, you can tell him, when you manage him, when you treat him, you can tell him, well, it's not heart attack because you don't have 1, 2, 3, 4. Clear? So don't forget to ask about the main concern. What's your main worry? What's your main concern? Right after the presenting complaints, I will ask about the main concern. Okay. After asking about the main concern, I will start doing my DDs. What are the DDs? What is the meaning of DDs? Differentials. What are the differentials? Differentials means the questions that you will ask to exclude other conditions to reach your diagnosis. Differentials. Okay, I'm not going to discuss differentials now because differentials will be discussed when we start to talk about every and each topic. Then I will tell you chest pain, what are the differentials? Cough, what are the differentials? So it's not going to be discussed now. So I will do differentials. And one thing I would like you to know, that when you do differentials, when you start asking the questions to your patient in order to confirm or exclude something about his condition, make sure I need to ask a maximum of 4 differential. Maximum of what? 4 differential. Maximum of 4 differentials needs to be asked. Maximum, Dr. Mo? Yes, maximum, guys. Not 7, not 8 differential, not 15 differential. So write down this just to remind you. So differentials, maximum of 4 differentials. Remember, maximum of 4 differentials I will need. But be careful, because in these 4 differentials, I need to exclude. I need to include what? The most serious. The most serious, or what will kill the patient first. What do you mean, Dr. Mo? For example, I have a patient who came to me with rash, presenting complaint. Then I asked him about the rash. Anything else? He said fever. Anything else? He said shy away from life. These are the presenting complaint. I explored them. Then I came to the main concern. What's your main worry? What's your main concern? Doctor, I'm worried about having whatever. Then when I start the differential, my first differential should be what? Meningitis. Why? Because meningitis is the thing that will kill the patient first, or the thing that will affect the patient first. Second differential, for example, cellulitis. So when you give differentials, maximum of 4. Unless you did not reach your diagnosis, carry on. But as long as you reach your diagnosis, so maximum of 4 differential. Number 2, Dr. Mo, in these 4 differentials, what should I include? The most serious. What will kill the patient first in these 4 differential? And the most common. So after asking about differentials, all this in P1, don't forget, yeah? We still in P1. After asking about differentials, I will end my differentials by what we call it flows. What is flows? Flows, F for fever, L for loss of appetite, or lethargic, or L for lethargic, A
appetite, W weight loss, S night sweat. So flows, F for fever, L for lethargic, A appetite, appetite loss, weight loss, S night sweat. That will be the end of my P1. So this is my structure. P1, presenting complaint. Can you tell me more about it? He will give you some symptoms, recap them, and then ask about the rest. I use Socrates in pain. I use Udipara and anything else. After exploring the presenting complaint, what to do? Anything else apart from the pain? Yes, he will give you something else. How to explore it? Because the something else that he will give you, it became as P1. So again, can you tell me more about it? He will give you some things. Then again, use Udipara or Socrates. Then anything else? He will give you another complaint until you explore all the complaints. After that, you will use concern. Apart from the pain and the fever and the cough, for example, what's your main worry? What's your main concern? What's concerning you the most? He will give you main concern. Be careful if he gives you a concern. Be careful that number one, you need to exclude that concern in your differential. If the patient told you my main concern is MI, is heart attack, so it will be my first differential. I will say to him, may I ask why you think about heart attack? And it will be the first differential to exclude them. Be careful that if it's not heart attack, you need to tell him in management that it is not heart attack. Be careful. Use the main concern in differential and use the main concern in management.
Then I will ask about differentials, and I said differentials needs to be maximum of 4. The most serious and what will kill the patient first. Then I will ask flows. Then I will ask flows. Okay. That's all in P1. That's all in P1. Okay. When after P1, for example, after P1 and asking about the symptoms and flows and DDs, for example, I reached the case may be anemia. For example, the patient came with a condition, he's tired, I explored the tiredness, can you tell me more? After exploring anything else, he said, yes, doctor, I feel lethargic, then doctor, I feel lightheadedness, then doctor, I feel heart racing, and after that, I've asked my DDs and I've asked my flows, and I reached, after P1, the condition that I'm thinking of maybe anemia. Do not forget, everybody else that day in the exam are going to the exam to diagnose. But only Dr. Mo's candidate will be going not only to diagnose anemia, but also to know the reason why he's having anemia and does he have any complications. So once you reach your diagnosis, once you reach what you are thinking of, don't forget to ask about 2 things. Don't forget to ask about 2 things. What are they? I said, now I have reached my diagnosis, which is anemia. While I'm taking the presenting complaint, I started thinking of anemia. Don't forget to ask about anything. Risk factors, as well as what? Complications. So risk factors and complications. For example, if the case is anemia, I've asked my patient, how can I help you? He said, I'm tired. Anything else apart from the tiredness? Lightheadedness. Anything? Chest pain or, for example, heart racing. Then I started thinking of anemia. I asked differentials like flows. I asked differentials of tiredness, causes of tiredness. It is anemia. Before you finish your P1, don't forget to ask what? The causes of anemia, the complications of anemia. So the reason why he may be having anemia. Because if you manage anemia, but you don't talk about the cause. For example, I have iron deficiency anemia because I don't eat well. There is a problem in my diet. Imagine if you give me iron tablet to treat the anemia, but you don't talk to me about the diet. It is the reason why I'm having anemia. You're gonna lose marks. So be careful. After you recap, after you finish your presenting complaint and your differentials, and you reach that the case is anemia, for example, make sure you ask about the risk factors for which a patient can have anemia, and make sure you talk about the complications. Okay? Then after P1, I have P2. What is P2? P1 is presenting. P2 is past. So P2 is past history. P2 is past history. Past history. And for that, because there is number 2, I will have 2 questions. I will have number 1, past history of the presenting complaint. And I will tell you now what do I mean by that, and past medical conditions. So past history of the presenting complaints and the past medical condition. Past history of the presenting complaint. Why did the patient came from the first place? Chest pain. So when I reach P2, I will ask him, have you had similar pain before? Past history of presenting complaint. Have you had such a cough before? Have you had such eye problem before? So past history of the presenting complaint. The second is past medical conditions. Do you have any medical condition, any long-term condition that you suffer, or any medical condition that you have? And by that I mean the chronic condition. Like what? Any diabetes, any high blood pressure, any cholesterol problem, any strokes or many strokes, any heart attacks, any thyroid problem. So 5-6 conditions I need to ask about under past medical conditions, which are high blood pressure, diabetes, cholesterol, strokes or many strokes, heart attack, and finally thyroid, and finally thyroid, and finally thyroid. So these are the past medical conditions that anyone can have, and I can ask them to anyone. However, if you ask the patient and you say to him any medical conditions at all, and they said no doctor, I'm totally fit and well, I don't have anything, you don't need to dig, move on. He will give you a clue, totally fit and well. But if he doesn't, then you can ask these medical conditions. After P2, I will go to P3, 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 which I call it lifestyle. So P3 is lifestyle, lifestyle questions. So it will be DESA. I will tell you now the meaning of DESA. DESA plus or minus sexual history and IV drug abuse history. So P3 is what? Lifestyle. P3 is what? Lifestyle. What are the questions about the lifestyle that I need to ask? DESA plus or minus. Plus or minus means you can ask them or not depending on the case, and that will come later on in the course. What do I mean by depending on the case? Plus or minus sexual history and IV drug abuse. So DESA. D for diet, E for exercise, S for smoking, A for alcohol, alcohol. Plus or minus sexual history and the IV drug abuse. And whenever we reach the topics, I will tell you when to ask about sexual history and how, when to ask about IV drug abuse, because that will be specific for specific cases. Okay, so P3, DESA, plus or minus sexual history and IV drug abuse. Okay, number one, do I have to ask DESA plus or minus sexual and the IV drug in all cases? No. Do I ask some of them? Yes. So I will select what is relevant to the case. Dr. Mo, how do I know that this is relevant to the case or not? As we go along with the course, you will know. But for now, at your level, at the first lecture, at the first half an hour in the course, DESA plus or minus sexual and IV drug abuse is what? Mandatory or not? It's not mandatory. Selective. What do I mean by selective? I will ask what's relevant to me. I will ask what is relevant to me. So diet, exercise, smoking, alcohol, sexual history, IV drug abuse. For example, a patient is coming with, a patient is coming with discharge from the front passage, presenting complaint. A female coming from with discharge from the front passage. What will diet do with this presenting complaint? What will she benefit from you asking about her diet? What will diet relate to discharge from the front passage in a female? However, sexual history is a must. Okay? What will be exercise do with a discharge from the front passage? However, sexual history is a must. However, smoking is a must because it may be cervical cancer, for example, and smoking is a risk factor. So my point is, don't worry about it. You will know what's relevant in the course. But the main thing is, that will be plus or minus. So either or. So I'm not going to ask all of them. I'm going to ask some of them that are related. DESA plus or minus. And because P3 is called the lifestyle, so before I ask B3, I will signpost. I will tell my patient, well, Mr. Andrew or Mrs. whatever, I'd like to ask you some questions that may sound quite intrusive, but it's a part of my consultation. Or I'd like to ask you some questions, for example, if you're asking about sexual history, yeah, I'd like to ask you some questions that may sound quite intrusive, but I'm sorry, it's a part of my consultation. If I'm asking about diet, exercise, smoking, alcohol, I would say I would like to ask you some questions, okay, about your lifestyle. Would that be right? So signpost before you ask lifestyle, signpost before you ask P3. Okay. Then after P3, I have maftosa, 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 maftosa. M4, medications, medications. M4, medications. A4, allergy. A4, allergy. F4, family history. F4, family history. T for travel history and contact history. Travel history and contact history. O for occupation. Occupation. What do you do for living? What do you do for living? S for social. S for social. Who do you live with? Who do you live with? How's things at home? A for anything else. A for anything else. Guys, so مفتوزة. M for medication. A for allergy. F for family history. T for travel history and contact history. O for occupation. What do you do for living? S for social history. Who do you live with? How's things at home? A for anything else. That's important for me to know. So think about it. Think about it. I started my station, or I started my case, or I started talking to the patient by what? Open question. Can you tell me more? So I started with open question. Can you tell me more? And I ended by what? Anything else that is important for me to know, which is open question. So always start your station with open question. Can you tell me more about it? And end your station with anything else. And مفتوزة A for anything else. Anything else that's important for me, which is again open question. So start with open question and end with open question. Okay? So there is another point I would like to highlight. There is another point that I would like to highlight. If the patient is coming to you with, acute condition, for example, doctor, chest pain, I can't breathe, severe pain, doctor, acute condition. If the patient is coming with acute condition, do you think, would you ask him about diet and exercise? Is there a space for you to ask, how is your diet, Mr. Andrew? No. So if the patient is coming with acute condition, you're not gonna ask about diet and exercise. That's one thing. If the patient is coming, when I mean diet and exercise, I don't mean only diet and exercise, but I mean basic. If the patient is coming with a chronic condition, a patient is having diarrhea for 8 weeks, a patient is having diarrhea for 10 weeks, a patient is having shortness of breath for 3 months, a patient is having a vision problem for 6 weeks, which I call it what? Chronic. Something for a while. Always make sure in these cases, can you see occupational and social? Occupational and social, which I ask at the end of the case, at the end of the station. Occupational, what do you do for living? And social, who do you live with? I will bring them a bit earlier. What do you mean, Dr. Mo? After exploring the presenting complaint, diarrhea, vision problem, whatever, and after asking the P1, because it's a chronic, because a patient is having a chronic condition, diarrhea for a while, vision problem for a while, which basically, if I have diarrhea for 7 weeks, can I go to work? No. Can I leave even my house? Diarrhea? No. If I have vision problem for 6 weeks, can I drive? I will struggle. A condition that's affecting the quality of my life, chronic. However, a chest pain for half an hour, is it chronic? Has it affected my life yet? No. So if a patient is having a chronic condition, I will ask occupation and social early, after asking about the complaint, which I call it psychosocial. Psychosocial. So I will bring psychosocial early. Mr. Andrew, you've mentioned to me that you are having diarrhea for 6 weeks. Yes, doctor. That sounds quite challenging. Can you please tell me how is it affecting your life? Can you please tell me how is it affecting your daily activity? Can you please tell me what do you do for living? Are you able to go to your work, or are you able to do your job even though you are having the diarrhea? So that's what we call it psychosocial. So psychosocial means the impact of his condition on his life, on his work, on his daily activity, on the relationship with people around him. Psychosocial. So if the case is acute, don't ask DESA. If the case is chronic, bring psychosocial early. Right? So now, after I finish maftosa and anything else, I will end by the last line. Before I mention examination, I will end by my last line, which I call it expectation. Mr. Tony, what are you hoping from today's consultation? Mr. Tony, what are you expecting from us today? So expectation, 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 expectation is basically you are trying to ask what is the patient expecting from you. So after you finish your history taking, always end your history by what are you hoping from us today, or what are you expecting from us today, or what would you like us to do for you today, about what are you expecting in terms of when you came. Are you expecting a scan? Are you expecting a special kind of treatment? What are you expecting? So always end your station by expectation. Okay, so I will take a picture of this. All right, so whenever we need it, we want it. Okay, so basically this is my first slide about history taking in medicine cases. Anyway, so I finished my history, and I finished the expectation. Now what should I do? What should I do? What should I do? Now after history, I go to examination. That's my structure. So after history, I go to examination. Don't forget, don't be lost. So far, I'm only discussing history taking in one case, which is medicine station. So far, I'm only discussing history taking in one case, which is, yes,